What we're looking at in this photo is a hair loss condition known as alopecia areata. This is where you get coin-shaped areas of hair loss. And unfortunately, this impacts close to 150 million people around the world. Together, we're going to explore why one develops alopecia areata and what treatment options are that exist. Alopecia areata is an autoimmune hair loss condition where our own body attacks our hair follicles, leading to these circular areas of hair loss. And you could also get these circular areas in your eyebrows as well as in your beard. I, in fact, have one of these tiny circles on my own scalp, even though it appears that I have a lot of hair. Now, that's the most common presentation for alopecia areata, but it's also possible to develop what's known as alopecia totalis, where you can get complete loss of your scalp hair. And this can extend to your eyebrows as well as to your beard. And finally, there's the possibility of developing alopecia universalis, where you can also lose all of your body hair in addition to losing your scalp and facial hair. So there's a few causes and triggers that we must consider. Of course, autoimmune is at the top of our list. Yes, we do believe that our own body is attacking our hair follicles. We believe specifically T cells are the main culprit for why this is happening, and cytokines, IL-2, IL-15, as well as IFN gamma. But that's not the only part of this story. We think that there's also a genetic component. So if you come from a family member that has an autoimmune condition or has a history of alopecia areata, you happen to be at increased risk for developing this hair loss condition. And then we get to something that's really interesting: external environmental triggers. So if you have been exposed to hay fever, you have dermatitis or asthma, your risk goes up. The risk of your body attacking its own hair follicles goes up. That might actually explain why I myself have a small patch on my scalp, because I have a history of asthma. And then, of course, we have to consider physical and emotional trauma. That can also be a trigger for why someone develops alopecia areata. It's important for me to point out that alopecia areata is a condition that's unpredictable. It can have a gradual onset or a rapid onset. When we try to identify alopecia areata, we look beyond the hair sometimes. We look at the nails, because 20% of patients present with issues with their nails. They can have brittle nails, they can have pitty nails, they can have white dots on their nails, or itching or scratching or pain around your skin. These are signs that help support that you might have alopecia areata. And then we perform what's called trichoscopy. This is where we take a device, it's like a microscope, and we look at the hair follicles. We look to see, are there broken hair follicles? Are there short hair follicles? And we're looking for a classic sign known as the exclamation mark. This is where the hair follicle is really thin at the bottom and thick at the top. This is a classic sign that you have alopecia areata. It's worth pointing out additional steps we might take to confirm that you indeed have alopecia areata. Sometimes performing a blood test helps us identify, do you have another autoimmune condition that's really playing a role in this? Maybe it's a thyroid condition. And we can also perform a biopsy. Okay, it's a really tiny biopsy that we take where we think you're experiencing alopecia areata. In fact, I had someone perform a biopsy on my own scalp to confirm that that little circular area on my scalp was indeed alopecia areata. And then we get to treatment options, and there's a lot for us to explore. First and foremost, you can try using Rogaine 5% foam over the counter and applying that once a day. There's also the possibility of using a DHT blocker like finasteride or dutasteride. I made an entire video about both of these medications, and I encourage you to check it out. Now, there's an in-office procedure where you get corticosteroid injections on a routine basis, and this helps lower the inflammation around the hair follicles, and this is shown to be very effective for mild and moderate alopecia areata. Sometimes you have to go on oral methotrexate or oral corticosteroids. And then, of course, there's the option for individuals who have severe alopecia areata to use JAK inhibitors. The FDA just approved its first medication known as Olumiant. It's the commercial name for a JAK inhibitor that has demonstrated to help a lot of individuals regrow their hair. During the clinical trials, 40% of the individuals taking the medication demonstrated within 36 months a 80% increase in their hair growth. That is unbelievable. This provides hope for a lot of individuals living with the severe version of this hair loss. Now, if you don't want to use medication to address this hair loss, That's okay. There are options. There's the ability to go bald, which is completely okay. There's also the ability to use a wig or a prosthetic, and we actually provide these options to our patients, and they're very happy because some of these wigs and some of these prosthetics look super, super natural. So they really help to restore a lot of confidence. Unfortunately, I can't offer patients with this hair loss condition a hair transplant because my concern is that when we transplant hair into your scalp or your eyebrows, your body's going to reject the hair follicles. So we're very cautious with these types of patients. We will attempt to do hair transplants, but we'll try very small transplants. We'll try a few follicles at a time just to see if the body will reject the hair or not. Because remember, this is an autoimmune hair loss condition. We spent a lot of time together talking about alopecia areata. And I understand that living with this hair loss condition can be quite emotionally distressing because you feel like it's kind of hopeless. Your body's attacking your hair follicles. What are you supposed to do? I'm here to help you address your questions. I'm here to help you figure out what the best treatment options are, and I hope I was helpful. If there are questions that you still have, please leave them below. I promise you I will make sure to answer them. And as always, I'm here on your journey to help you address your hair loss.